Thank you. The final item of business is the members' business debate on motion 15868 in the name of Emma Harper on Eating Disorders Awareness Week 2025. This debate will be concluded without any questions being put, and I would invite those members who would wish to speak in the debate to please press the request to speak buttons, and I call on Emma Harper to open the debate. Up to 7 minutes, please.
Thank you, Presiding Officer. Dennis Robertson MSP first led this debate in 2012 following the loss of his daughter Caroline in February 2011. She was diagnosed with anorexia nervosa. This is what Dennis said then. I want people to be aware of the symptoms and get help as soon as they can. I'm trying to ensure GPs and other medics become more aware of the dangers. Get help as soon as they can, Dennis said. So I'd like to thank colleagues across Chamber for signing my motion enabling this debate. This year, Eating Disorders Awareness Week is February 24 until March 2nd. The Eating Disorders charity BEAT provides so much support, and I welcome Alec Jones from BEAT to the gallery this evening, along with members of the Lived Experience panel and trustees of Support ED or Sported. Thank you for being here in the gallery this evening. I do believe that it's necessary to continue to raise awareness so that as knowledge improves, better care can be provided. An estimated 1.25 million people in the UK are living with an eating disorder right now, 1 in 50 people in Scotland. These devastating illnesses can affect anyone of any age, size, gender or background. They can easily go undetected. We know the signs and symptoms aren't always visible or easy to pick up, but symptoms can include spending a lot of time worrying about your weight and body shape, avoiding socialising when you think that food will be involved, eating very little food, making yourself sick or taking laxatives after you eat, exercising too much, having very strict habits or routines around food, and changes in your mood such as being withdrawn, anxious or depressed. Previously, Presiding Officer, each year a different theme focused on the many types of eating disorders. These include anorexia and bulimia nervosa, avoidant restrictive food intake disorder or ARFID, and binge eating disorders, and variants which are classified under other specified feeding or eating disorders, OSFED. Last year's debate highlighted ARFID, and previous years included diabulimia, which is where a person with type 1 diabetes deliberately omits taking their life-saving insulin to help lose weight. Eating disorders have the highest mortality of all mental disorders and have serious medical consequences as well as risks of suicide. And a lot of work has been done in recent years with advances in treatments, including tackling associated stigma. The services created are inclusive to treat all people, regardless of age and severity, with the development of all-age services and early intervention approaches. Last year, the number of children and young people presenting to CAMHS, the Children and Adolescent Mental Health Service, and then admitted to hospital with an eating disorder has increased rapidly. Children and young people are presenting to paediatric settings later and often more physically unwell. There has been a significant increase in the annual incidence in 10 to 14-year-olds in the last 7 years as well. The prevalence of anorexia nervosa in the general population is approximately 1% among women and 0.5% among men, and it is reported that half of those who meet diagnostic criteria in the community do not access treatment. Bulimia nervosa is reported to have a prevalence of about 2% and binge eating disorders up to 4%. The population prevalence of ARFID is not known, largely because it's a relatively new diagnosis and still not well known. I am aware that educational seminars have been delivered by NES as a response to the high number of children and young people presenting, and at the request from the Scottish Government as well, to provide support and learning to staff working in acute paediatric settings to help better support children and young people and their families. So I'm keen to hear from the Minister what the uptake of attendance to the seminars has been by NHS Board and by clinician specialty, including GPs. It would be good to hear how GPs are engaging with assessment and then onward referral for persons that have a suspected eating disorder. And it would also be good to hear feedback as to the uptake of the TURAS online learning, especially in rural health boards like Dumfries and Galloway and the Borders. The National Review of Eating Disorders Services published a report. The report was published in June 2021, and there were 15 short, medium and long-term recommendations. And then the National ED Network was established, chaired by Professor Cathy Richards, to take forward the remaining medium and long-term recommendations. And it is interesting that the first recommendation related to the COVID-19 pandemic, asking for emergency funding to be provided. This was as a direct result of an increase in the number and severity of presentations related to the COVID-19 pandemic. And it prioritised physical health stability, risk reduction, support inpatient discharge and prevention of admission to hospital. Recommendation number 4 was to establish a lived experience panel to advise the implementation group and work alongside the National Eating Disorders Network. This recommendation advised that the panel should include patients, families and loved ones and the third sector representatives with diversity of panel membership, including representatives of all eating disorder diagnoses and men with eating disorders, LGBT representatives and people from ethnic minorities. And again, I welcome members of the panel here this evening. And just to highlight recommendation number 7, this is about early intervention, where key stakeholders and healthcare professionals should be able to identify the signs and symptoms of all eating disorders, including at early stages, and then know how to support and particularly signpost people into treatment. The SIGN guidelines have key recommendations from August 2022. They include early intervention, support for family and carers, and achieving and maintaining recovery, as well as healthcare professional training also. And I remind Chamber, I am still a healthcare professional. I'm still a registered nurse. BEAT has developed training for health professionals that has the potential to save lives, and it is free. The Royal College of Psychiatrists recognises how important it is to have guidance across all healthcare settings and created the Medical Emergencies in Eating Disorders Guidance on Recognition and Management. This replaces the previous Marzipan and Junior Marzipan guidance. So lots of action has been implemented, and I'm conscious of time, Presiding Officer. So finally, if anyone has a worry about themselves or a family member, I would ask them to consider calling the BEAT helpline in Scotland at 0808 801 0432 and speak in confidence to an advisor. There is so much being done, and it needs to continue at pace, I would ask the Minister. So I look forward to hearing colleagues' contributions and the Minister's response this evening. Thank you.
Thank you, Ms Harper. We now move to the open debate. Backbench speeches of up to 4 minutes. I call Claire Haughey to be followed by Alexandra Stewart. Ms Haughey.
Thank you, Presiding Officer, and I refer members to my entry in the Register of Members' Interests, particularly to the fact that I am a registered mental health nurse holding a current registration with the NMC, and that I am employed as a bank nurse by NHS Greater Glasgow and Clyde. And I'm pleased to speak in this debate today, which has become an annual fixture in the Parliament to mark Eating Disorders Awareness Week. And I'd like to thank my colleague Emma Harper for lodging this motion and for her commitment to bringing this subject to the Chamber and for focusing minds on how important it is. Eating disorders do not discriminate, and anyone can be affected by them. They're serious illnesses that can change and even end lives. The Eating Disorders charity BEAT estimate that at least 1 in 50 people are living with an eating disorder, but the real number could be even higher. Disorders like ARFID, anorexia, bulimia, binge eating disorder and OSFED are complex mental health conditions. And of course, they don't just affect the person with the condition, but their family and their friends too, who can feel helpless and heartbroken as they watch their loved ones struggle. With that level of prevalence, most of us probably know someone who is or has been affected. This is why the focus of this year's Eating Disorder Awareness Week is eating disorders can affect anyone, regardless of their age, gender, sexuality, ethnicity or background, and it's not always who you would expect. Eating disorders are often misunderstood, mislabelled or undiagnosed, which can then prevent people from reaching out for help. And the risk is not receiving support and treatment for any mental illness can be incredibly dangerous. It's even more true for eating disorders. Together, they are responsible for more loss of life than any other form of psychological illness. with anorexia nervosa having the highest mortality rate of any mental illness. And when they're not fatal, they can still lead to severe long-term physical health consequences, such as organ damage and fertility issues, and can increase the risk of heart problems and type 2 diabetes. This year Beat's Eating Disorders Awareness Week survey showed that 4 in 5 respondents answered that they would feel more comfortable opening up to others about their experiences if there was a greater awareness and understanding of eating disorders. Respondents reported fearing stigma around saying that they have an eating disorder due to misconceptions about who is affected and the lack of knowledge about how eating disorders present. Challenging these misconceptions can lead to people seeking help earlier, which can increase their chances of a full recovery. The topic of stigma is one which frequently appears when we talk about eating disorders, and last year's debate underlined that with its focus on ARFID, a less well-known condition. And our colleague Kevin Stewart spoke about the fact that 1 in 4 people who develop an eating disorder is male, and there is still much work to be done to raise awareness of that fact and change attitudes to make sure no one is afraid to come forward for help. Since I first spoke on the subject in this chamber, there's been much positive progress. The Mental Health and Wellbeing Strategy and Delivery Plan specifically mentions stigma as a phenomenon which requires a sustained effort to tackle. And there has, of course, been a national review of eating disorder services, the establishment of the National Eating Disorders Network, and work with those with lived experience. Presiding Officer, challenging stigma is not an easy task. Eating disorders by their very nature are associated with deniability, secrecy, stigma and shame. But in order to help, treat and save lives, it's a challenge we must all rise to. I'd like to once again thank Beat for all that they do to this end, for the material that they provided for this year's Awareness Week. And I would recommend their website and helplines as a trustworthy, reliable and judgment-free source of support to anyone who's concerned about themselves, a friend, colleague or loved one.
Thank you, Ms Hockey. I now call Alexandra Stewart to be followed by Cara Mocking. Mr Stewart.
Thank you, Deputy Presiding Officer. I'm pleased to be contributing to this member's business debate, and I'd like to thank Emma Harper for bringing this debate to the Chamber this evening. And as we already know through the motion, we already are in Eating Disorder Awareness Week, which runs until the 2nd of March. This year's theme is about eating disorders can affect anybody, and that is very welcome that that is the case. I feel it is vital that the great many misconceptions about eating disorders are challenged as vigorously as possible, especially as public misunderstandings and stigma can often prevent people reaching out for help. Help is available, but we need to make sure that it is provided across all areas, and we don't have a postcode lottery, which does happen from time to time. Not only can eating disorders affect anyone, Deputy Presiding Officer, but it's also the case that it involves sometimes the most individuals that we wouldn't expect. And now we are seeing many younger people, through image and portrayal of what they should look like, what they might look like, being affected. At the moment, in the United Kingdom, we know there are about 1.25 million people living with an eating disorder. Now, that equates to more than 1 in 50 here in Scotland. However, the real number is probably much higher because many cases go unreported. This is due to some... Absolutely.
Fergus Ewing.
Was the member aware of the Radio 4 programme last week, which highlighted that many children, particularly in secondary school, especially females, though not exclusively, are afraid to, for various reasons, to use the lavatory, the toilet facilities in schools, so that some of them refrain from eating and drinking for the whole day, and that one mother in particular contributing to the programme said that this triggered an eating disorder in her daughter, which had very serious complications for her. Does he believe that that's an issue that should be looked at by the government when they're consulting on changing safe-sex separate provision in schools for toilets?
Alexander Stewart.
I thank Fergus Ewing for that intervention, Deputy Presiding Officer. I think he makes a very valid point. We are aware, as that programme highlighted, that there are a number of schools that are finding that girls are not now using their facilities because of what may happen in these facilities, and that is having an effect on them when it comes to eating. So I think that should be looked at by the Government, and I wholeheartedly agree with Fergus Ewing in his comments this evening. As I said, it's underreported, and we sometimes find that it's due to sometimes the general practitioner not knowing where and when things happen. And I have heard this evening about the charity Beat and what they are doing, and I wholeheartedly support them. We know that eating disorders come in many forms, with anorexia, bulimia, binge eating disorders, as well as lesser-known conditions are often misunderstood, mislabelled or even underdiagnosed. And it's salient to mention that eating disorders are not just affected on the one person who has the condition. Friends and family become carers, with many of them feeling helpless, heartbroken, watch their loved ones struggle with that disorder. Deputy Presiding Officer, eating disorders are one of the largest mental health challenges of our time. Eating disorders are about much more than just food. It is about image, it's about social media, it's about many other issues that come into the mix. They can also be a coping mechanism and broader complications for individuals as they progress. BEAT, formerly known as the Eating Disorder Association, is extremely strong and positive with that regard. Their national helpline encourages and empowers people to seek support and advice. As you've listened to this evening, illnesses and support towards individuals are vitally important. The family support, the friends, are equipped with skills that they will look after their loved ones so that they can ensure that they get that support. BEAT also advocates an increased knowledge among healthcare and relevant professionals. So in conclusion, Deputy Presiding Officer, people have the courage to come forward. If they have that courage, it's important that they get the help in the right place, at the right time, and they get that right help. I hope that in the Minister's summing up that there will be an opportunity for the Scottish Government to give us an indication where they're taking this position, not least as we need to see much more focus on this issue brought forward on a national level. We all want to ensure that every individual who has an issue is supported, their families are supported, they're brought together so that they can support one another and live free of eating disorders. Thank you, Presiding Officer.
Thank you, Mr Stewart. And I call Cara Mockin. Ms Mockin.
Thank you, Presiding Officer. And can I thank Emma Harper for bringing this important debate to the Chamber again this year. And can I also welcome the guests in the gallery. It's great to have you here. Like other parties, Scottish Labour supports the aims and objectives of Eating Disorder Awareness Week 2025 and its goal to raise awareness of how eating disorders can affect anyone. I ask people, if they can, to seek help, as the motion says, through contacting their GP surgery or by phoning the BEAT helpline, or indeed trying to make contact with the BEAT group through their website. To better understand these complex mental illnesses and abolish stereotypes, I would like to thank BEAT for their survey showing us that 4 out of 5 respondents thought that greater public awareness would make them feel more comfortable to talk about their eating disorder, and it's an important point that we in the Chamber can contribute to. We know eating disorders don't just affect the person with the condition. Their friends and family who can become carers are often forced to watch their loved ones struggle with this battle. So having these open conversations relieves the stigma for families as well. And so it really is very important that we make sure that we have these conversations and reduce the stigma to allow these discussions to continue. Can I acknowledge the work undertaken by BEAT? Of course.
Emma Harper.
I thank Cara Mockin for giving way. She mentioned stigma, which is absolutely important. Do you think that social media also has an issue that can contribute to an increased prevalence of eating disorders? And it's all kind of tied in, looking at stigma, social media and various aspects that lead to an increased number of young children and adolescents with eating disorders.
Cara Mockin.
Thank you. I really thank the member for that intervention. I think it's a very important point. And as a parent of teenage children, I have a teenage daughter, I'm concerned about some of the things that we see in social media, and so we all have a responsibility to talk about that so that we can address it. As we have already heard, eating disorders are not uncommon. 1 in 50 people in Scotland and the wider UK are affected by them. We know that, and tragically, their impacts can be fatal, and this is why we must raise these issues whenever we can. I would also like to raise the issue about age and diagnosis, because sometimes that can be misread. Most eating disorders do develop during adolescence, we know that. However, there are cases of eating disorders developing in very young children and in adults, and we have some examples of adults well into their later years, into their 70s. And this might be shocking, but it acts as a reminder to us all that eating disorders are both prominent and serious across our whole population, and often still have a taboo surrounding them. And we know this particularly when men are involved, they feel they can't speak about it. So again, very important for today's debate. As BEAT have indicated, it is essential that we as MSPs take this role seriously. We need to raise awareness, but also fight for funding for research and scrutinise the government on delivering the full implementation of the plans around eating disorder services. And I know other members have asked the Minister to respond to that. One of the review's recommendations was to establish a national eating disorder network to oversee implementation, which was published in July last year. The network has the responsibility of coordinating training and research implementation, along with improving links between primary and secondary care services. And I'm very interested in this point. People will know that I worked in the NHS as an allied health professional, so I'm very aware of the importance of raising training and that link between primary and secondary care. Professionals in that group often discuss the importance of training and how we should ensure that people are aware of and can spot the various conditions or the various build-up across the spectrum to ensure that we can signpost and have appropriate resources. I'm aware of time, Presiding Officer. I would just want to make it clear that I am really impressed by the speeches in the Chamber tonight, and I hope that we can continue to have this conversation, because that's what tonight's debate was about. Thank you.
Thank you, Ms Mockin. And I now call on Minister Marie Todd to wind up the debate. Up to 7 minutes, please, Minister.
Thank you, Presiding Officer. I'm very grateful to Emma Harper for lodging today's motion and for enabling this debate to mark Eating Disorders Awareness Week. I am also delighted to welcome representatives of BEAT to the Chamber this evening. It's very lovely to see you here. Raising awareness is crucial to understanding the significant impact that eating disorders have on individuals, their families and friends. I want to begin with an assurance to members and to all of those affected. This government continues to dedicate significant efforts and resources to ensuring that anyone affected by an eating disorder receives the right support in the right place at the right time. We remain committed to improving eating disorder services in Scotland. I'd also like to express my sincere gratitude to everyone across the country who works tirelessly every day to support the recovery of individuals with eating disorders and their families. As we've heard today, this year's theme is about raising awareness that anyone can be affected by eating disorders, regardless of age, gender, sexual orientation, ethnicity or background. Early recognition of the symptoms and timely intervention significantly improve the chances of full recovery. So raising awareness plays an absolutely crucial role in breaking down stigma, empowering individuals to seek help sooner and ensuring that they receive the support they need. Over the last 4 years, we've taken significant action to ensure that those in need of support for an eating disorder can receive timely access to the appropriate treatment. We continue to provide funding to NHS services and to the third sector, as well as working with people with lived experience to deliver the recommendations of the National Review of Eating Disorder Services. Since the publication of the review, we've made real progress in delivering the short-term recommendations, with work underway to deliver the remaining recommendations. The recent publication of the National Specification for the Care and Treatment of Eating Disorder Services marked a major step forward in improving eating disorder care in Scotland. It provides a clear framework to support both the NHS and community services in delivering high-quality, person-centred, safe and effective care for children, young people and adults. We'll support NHS boards and other partners to implement this specification aiming to ensure that everyone affected by an eating disorder, no matter where they live, receives the right support at the right time. This is a crucial milestone in strengthening services, improving outcomes and ensuring that no one faces an eating disorder alone. We've also established the National Eating Disorders Network to support the implementation of the specification and the remaining recommendations from the review. The network aims to create a more integrated, person-centred approach, leading to better outcomes and ensuring that individuals receive the support that they need. The network's launched a series of educational webinars for clinicians to enhance expertise in emerging areas of eating disorder care. And for example, the first session focused on the intersection of eating disorders and autism, offering insights to support more tailored and effective treatment approaches. And over 100 people attended that first session in November. Recognising the value of partnership working, the networks organised regional meetings in the west and south east of Scotland. These bring together NHS teams, third sector organisations and private practitioners to share best practices, foster innovation and to strengthen joint working across all age groups. Now, Emma Harper is absolutely correct that it's vital that professionals feel confident in spotting the early signs of an eating disorder and understanding the complexities of this illness. Other members raised it too. There are key areas where training needs to be improved and mapped out where training was already available. Last month, the training on eating disorders in children and young people was updated. It now includes refreshed resources that incorporate role play. I can't give Ms Harper a breakdown by board, but training was moved to live online delivery during and since 2020, and that enables equal access to all boards across Scotland, and we hope that they'll continue to take the offer up. NESS offer a variety of training courses through TURIS, and that includes family-based therapy for eating disorders, which has been completed by 175 clinicians, cognitive behavioural therapy for eating disorders, that's been completed by 223 clinicians across CAMHS and adult services, and eating disorder assessment and management training, that's been completed by 213 clinicians. And through the funding that's allocated to BEAT, we have introduced Beyond the Symptoms training seminars for GPs and healthcare professionals training to support them to identify when a patient has an eating disorder and to confidently intervene early. By the end of the financial year, BEAT will have provided training to a predicted 300 healthcare professionals, and that includes people from all 14 health boards, with the highest rates of involvement coming from Forth Valley and Highland. I'm delighted to share today that we have significantly enhanced the eating disorder resources on NHS Inform. That's Scotland's trusted and freely accessible health information platform. These resources support individuals and families and professionals, acknowledging the challenges of living with or caring for someone with an eating disorder. The resources offer clear and reliable guidance on the different types of eating disorders and their symptoms. Crucially, they highlight that support is available and that recovery is possible. By improving access to high-quality information, we are empowering individuals and communities to take informed steps towards recovery. I'm going to pick up again on the issue of stigma because I think it was raised by every member in their contribution, and I think I've said before in this chamber, it is the absolute bane of my life. Stigma around mental health issues, including eating disorders, is something that prevents people from accessing the help that is available and that they are entitled to. So we all have a collective responsibility to have open and supportive conversations about our mental health with those closest with us, with our communities and in our workplaces. And it does remain a key priority for the Scottish Government, which is why our mental health and wellbeing strategy sets out a vision for a Scotland that is free from stigma and inequality. Presiding Officer, I think it would be remiss for me to not link my statement earlier today, which followed the recent BBC programme highlighting some completely unacceptable experiences of inpatient mental health care. Many of those featured in that programme suffered from severe eating disorders. As I set out earlier, we're taking a number of actions with both health boards and the bodies which scrutinise them to ensure that our most vulnerable young people receive the high level of care that they deserve. I want to assure members that enhancing mental health services is a top priority for this government. The core mental health standards clearly outline expectations for mental health services, including those that treat individuals with eating disorders. I'd also like to highlight some of our wider efforts to improve support. In this financial year, we've provided just under £3.5 million across the west, east and north of Scotland to support the planning and development of regional elements of the CAMS service specification, which aims to ensure that services meet the needs of all children and families. And that includes the development of a 4-bed adolescent intensive psychiatric care unit in the west of Scotland, alongside the development of intensive home treatment CAMS services and regional pathways. The North of Scotland are leading the development of the regional intensive mental health home support, ensuring treatment closer to home and reducing psychiatric inpatient admission. These will be vital additions to Scotland's children and young people's mental health services, and they sit alongside the vital work that third sector organisations like BEAT do to support those with eating disorders, work which we are proud to support. Like others, I want to use this opportunity to urge anyone who feels that they need support for an eating disorder to speak with their GP and to access the resources that have been highlighted to ensure that they receive appropriate help as promptly as possible. Presiding Officer, I close by again thanking Emma Harper for lodging the motion for this debate. I'd also like to reaffirm my gratitude and support for all those people who work tirelessly to care for individuals with eating disorders and their families. Thank you.
Thank you, Minister. That concludes the debate, and I close this meeting.